minutes, I'm going to share a little bit overview about ILSS for some of you who may be joining an ILSS event for the first time. I must say, as I looked at the attendee list, it's always heartening to see people who are actively going through the application progress for our cohort 11 that starts next month. There are people who are currently going through the program. I also see quite a few alumni from different cohorts. Maybe panelists, these are your cohort mates here to cheer you. So it's always lovely to see people from the ILSS community who come back for these events, as well as the new set of people who are exploring both ILSS as an organization and this particular program. So really like a quick snapshot of what we do at ILSS. I'm going to just request Isha to help us with. So why do we exist, right? So our vision is really to build India's finest institution for leadership development in the social sector that will spearhead nation building in India. We'll work along with the government, and you see that in our mission, to train and develop India's best talent from across sectors to lead and serve in the social sector, supplementing the Indian government, which of course is the biggest scale in its impact, to create catalytic impact at scale. So that's what we do. And how do we do this? Our approach is threefold. One is by infusing talent, and the leadership program is our flagship program that aims directly at this, which is attracting India's best talent from across sectors to the social sector, so that collectively we can solve India's most pressing problems. Transform the quality of talent, which is where we work with people who are already in the sector leading India's social change to be able to enhance their capacities both at an individual level and at an institutional level. And last but not the least, working with getting individuals into the sector, working with individuals who are already in the sector, and also really enabling organizations to accelerate impact. So how do we work with social sector organizations to double the effectiveness as we create catalytic impact at scale? So this is our approach, and the flagship leadership program is what we started with. We're very happy to share that we are right now finishing up 10 editions of the program, and we're inviting applications for the 11th edition that's going to start next month. And this is a pioneering program in India to enable high quality talent, particularly leadership talent from diverse backgrounds, to take up leadership roles in the development sector. Like I shared, we also do programs for the social sector. In fact, the fundraising program is the first of the many programs we launch, which is the first of its kind, completely virtual learning course, which is designed for social sector professionals to be able to raise funds confidently and take those organizations to the next level. We also piloted ILSS online last year. Like they say, every calamity, every necessity is the mother of invention. And so last year when COVID struck, we introduced ILSS online, which is an online forum where we invite a variety of thought leaders and open it out to the wider community across social sector, corporate sector, students, employees, to really, really learn more about the development sector. So that's a little bit of what we do. For today, I'm going to bring us back to our lovely, lovely panelists. I'm super excited to be speaking and engaging with our three panelists here today. They are doing very different roles. They're from three different cohorts of the ILSS leadership program. And so very excited to learn more, not just about their journeys, but also what are they doing right now and what is it like to be in the social sector for them. Krishnakumar, Proteek, and Romonika, very, very delighted to have you. Thank you so much for joining us here today. I'm going to also walk us through a little bit of their profile so that you have an idea of where they came from, what they do. KK, as we call Krishnakumar, so bear with me, I'm going to probably keep calling him KK through the session. has nearly 30 years of experience working in Indian healthcare across R&D, sales and marketing, consulting. And in Jan this year, he transitioned to the nonprofit sector. You'll see that he's an alumnus of our cohort 8, which is again a blended model. And then he transitioned to the nonprofit sector early this year. KK started his career at IIT Delhi and then moved on to Hospi Medica International, and then after which he served several years at PwC's healthcare practice. He's worked with marquee clients in the private sector and also on providing solutions to the central and state governments, international development agencies, and thought leaders in the healthcare space. And now he's the India Managing Director of Equalize Health, a nonprofit organization. He's also an alumnus of IIT Madras and IIM Calcutta. Welcome, KK. Proteek. Proteek has a very different journey. He has over 25 years of experience working at reputed organizations across the manufacturing and telecom industries like Vodafone and Audio Wireless Broadband Bangladesh Limited. I know that specifically in our current cohort, there are quite a few telecom leaders who are looking to transition. And so Pratik is yet another person who worked across telecom before he made the transition to the social sector. Excels at building high performance teams and implementing programs that deliver continuous improvements, has now been leveraging the corporate experience to work in the development sector. He's the founder and director of NeevJivan Foundation, which is an organization that, of course, we'll talk a lot more about today, that works in the area of skill development and vocational training for rural India. Proteek completed his post-graduation from SP Jain Institute of Management in Mumbai. And last but not the least, we have Romonika, who's today the project director for strategic partnerships at Central Square Foundation based in Delhi. She has over 25 years experience that started with the 1993 batch of UPSC in the Indian Post and Telecom Finance and Accounts Service. And across her service, she's worked with a variety of projects and teams, the Department of Telecom, Government of India, and BSNL across revenue assurance, audit, project assessment, monitoring, and evaluation. Earlier in her career, she spent 8 years at Stephens College in Delhi, where she taught English at her alma mater after finishing her postgraduate program in English from there. She's volunteered in the social sector organizations in UK, Italy, and US while living there. With a flair for languages, she's comfortable with English, with Hindi, Marathi, Italian, and French. You all can engage with her offline on that, and also photography. Like I said, she currently works with Central Square Foundation, leading their work on strategic partnerships. Once again, to all three of our panelists, a big, big welcome. And thank you so much for joining us here today.
Thank you. Thank you very much.
So I'm going to start us off by asking us to share about what prompted this spark to transition to the social sector. I know each of you were in very different, Proteek, you were in telecom, Romonika, you were working with the government in different capacities, and KK, you were in PwC. What prompted the spark to transition to the social sector? Was there a particular incident, or was there something that happened? So what sparked it and what happened after that? Would love to hear from all of you, and then we'll take it from there. Anyone can get us started.
Okay, let me start. Okay, I've been contemplating this move for almost 4 to 5 years into the social sector. But every time, I got stuck, and the questions that came to my mind is, is this the right time? Have I saved enough, to sustain myself and my family in the years to come? So every time this debate came up in my mind, and I postponed my decision to some other day. But then a very interesting thing happened, which I'm sure all of you are aware of, is in the month of April and May last year, when the images of the migrant workers were splashed all over the media across the country, going back home. That's when it struck to me that there is an opportunity for a genuine effort towards, skilling them, reskilling them, upskilling them in such a manner that they don't have to go back to the city. So, so that's the primary, the start point, and that's when I decided to take the plunge and then never look back. So we started this organization, NeevJivan Foundation, sometime in January this year, and then we have been moving ahead.
Thanks, Proteek.
So for me, it was, though I started my first career was in the teaching profession, and I've sort of come full circle now back to education. But why I actually went into government, took the UPSC, was probably the idea of public service, really. So that was a sort of a continuing strain across whatever postings and portfolios I held in the last 27 odd years. And then I sort of, again, like what Proteek said resonated with me, I've travel that same road. Is it right for me? Is it okay? Shall I take the plunge? All those questions were sort of, churning from time to time. Whenever I did get a chance, I did volunteer from time to time when I was living outside the country with my husband. But finally, it was actually ILSS and a couple of very close friends who have been inspiring me over the years, who've been working in the social sector, very deep work in the social sector. And they actually led me to ILSS. And then it seemed to be the right time, because I had sort of reached the end of my learning curve where I was. And for me, I felt like I needed that growth, which for me happens when I'm outside my comfort zone. And I thought this is the time to get into the social impact space in a concerted way. So that's more or less it.
Thank you. And KK?
Yeah, so for me, of course, I've been engaged with the social sector in India, in healthcare especially, ever since I started working. So my first role in IIT Delhi was to design equipment for India's mass healthcare program. Right? So my first month in Delhi, after I moved from Chennai, had a visit to a few PHCs, primary health centers in UP and, of course, what is now Uttarakhand. So kind of was an eye-opener for me. I had never been inside a hospital or a primary health center anywhere in India. So it was a bit of a nice eye-opener. But subsequently, in my time with commercial medtech, I was more of a vendor to public healthcare systems. And then in consulting, had the opportunity to work with a lot of government agencies and IDAs, international development agencies. So for me, the turning point was two projects that I did in the 2016-17 timeframe. One was around, in transferring innovations in healthcare in India from the maternal and newborn space from India to other developing countries. And the second was a project that I did on health system strengthening, published subsequently by NITI Aayog. So those were two marquee projects which kind of solidified my interest in public health. And then, like with all of us, the time with COVID was a time for reflection and decision as to which direction to take my career. And that's how I kind of got thinking about it. And it was an ILSS online webinar, right, which was addressed by Dr. Nachiket Moore, who was former head of the Gates Foundation in India. So I listened, I signed up for that webinar wanting to listen to Dr. Nachiket, but I also discovered ILSS in the process, and then signed up for the leadership program, and then of course made the transition earlier this year.
Thanks, KK. Thank you so much for talking about that. Proteek, I'm going to ask you actually, since both our other panelists mentioned about how they found ILSS as well. What brought you to ILSS and the leadership program in this journey?
So basically, what I told you earlier was, the questions kept cropping in my mind, and I was I was not able to take a decision whether I should take the plunge or not. So obviously, I needed an external intervention, from someone who is an expert in this field and who has, who has been working in this field and helping people doing the transition. So that's one of the reasons why I opted for this leadership program in ILSS, and definitely this program helped me. And one thing that really stood out in terms of ILSS support in my transition was the network. The network or the contacts that ILSS brought to the table. Phenomenal contacts, and that's helped me build find my feet in this space.
Yeah, thanks so much for that, Proteek. We always tell participants, that our hope is that the program is only a starting point, because there's only so much that a one-time program will do. Our bigger hope is actually this community of like-minded people that you become part of, that will continue to, it's almost like who understand you, who get why you made this move. And so will continue to be there for you through your journey in the sector as well. Romonika, I'm curious to hear, what's been the ILSS community journey for you since then? I also know that in the network, there are a few other ILSS alumni as well you work with. So what's it been for you?
So yes, I think ILSS has been all that I anticipated and more. And of course, when I was interviewed for the course, I told a friend of mine, like, I had this interview with this course that I want to do. And he said, are you going to be teaching them, or are you going to be studying there? And I was like, no, this is like a university application with an SOP and all that. And so yeah, he was sort of amused at my predicament. And just that interview call itself, which had Anu and I think Isha on the call, was very comforting in the sense that there was that frequency matching. And I felt this is the place to be. Also, another very close friend of mine, Surabhi and Renuka, who have been, I think Renuka has probably signed in as well. They've been working in the social sector for a long time. So I knew, that was a touchstone sort of, like if they are recommending it, then it must be something really, worth the effort. Having said that, the community, the sense of community, almost a sense of family that developed among us as a cohort, and even like it's an alumni network now, that even if it's cohort 5 or 4 or 1 or whatever, we are sort of very comfortable with each other, and thanks to ILSS, that sort of sense of family prevails almost, which is very hard to bring about in mid-career people. They are not, fresh college grads. So that's something I really appreciate. And like I was saying before the call started, the ILSS call is the one that I always take, whatever I'm doing. So that's where it's brought me.
That's so encouraging to hear. Thank you so much for that. Katie, I'm going to bring you in. I know that you're our most recent graduated cohort participant, and you already enrolled in our next program. So KK folks is not just an alumnus of the leadership program in cohort 8, but is also, given his current role in the sector, is enrolled in the fundraising program in itself. And so, KK, what has it been like for you to be part of this community now across both our programs?
No, I think for me, the first program, the leadership program, was something that I needed to do to enter or help transition from a corporate role to the social sector. And then, of course, it had its own learnings, as part of trying to adjust to the expectation and the requirements of the role in social sector. And I think the second program, has been also important for me to find my feet in my new role. right? Because this is something, while I was aware of, healthcare sector and its challenges in India, uh, this particular role of being a fundraiser is something that I'd never done. And for me to be, successful in my current role, I thought that equipping myself with the skills, I think, was, and of course the practice, I would say, of fundraising was going to be critical. And I think one thing I can say as being a participant in both programs is that there is a lot of commonality, right? Uh, the obsession with starting on time, for example. It's like, second is the desire to solicit feedback, right? Regular feedback, almost to the point that it tends to bug you, but also to be able to act on feedback. It's not feedback just for the sake of it, but also the ability to act on feedback. And then, of course, the rigor with which the selection happens, like Romonika mentioned. Just because I was an alumnus of ILSS 8, I didn't have a free pass to the fundraising program. I had to go through the rigor, and then of course the lectures, the community. I think all that is pretty much standard. So I think that way it's a. I feel that this is a a good template, right? So that so anybody who looks at a transition to, I mean, that there are certain systems and processes which are at the heart of the organization. So that's been something that I very value.
Thanks, KK. I think it's a perspective that's relatively new to us, in that we have fewer participants who've now done across programs, right? So it's also a great validation for us in terms of certain things that we want to keep at the core, irrespective of what we do at ILSS. So that's very, very encouraging to hear. I'll also pass it on to the wider team for sure. I'm going to now almost double click on how you made the transition to what you're doing right now, folks, and also give our attendees today an opportunity to learn a little more about your role, your organizations, and the work that you all do. So let's start by, and Proteek, you've spoken a little bit about this already on how what prompted you to start NeevJivan. But if there's something you'd like to add, feel free to do that. For our other two panelists, one of the big questions we get asked is, there are so many things to do in the social sector. How do I know what can I do? How do I know which organization, what type of organization, what role? Because there are just so many, paths available, and which path do you take? So how did you approach it, and what were some factors that you would say led you to choose what you are doing now, right? There is a role in it, there is an organization, and there's a sector that you're attached to. And so what was that journey like, and what were some factors?
So there is a saying, that if you give a fish to a man, you make him live for the day. But if you teach him or her fishing, he or she lives a lifetime. So actually, that's the inspiration behind NeevJivan Foundation. So we are an organization which is working in the area of skill development and vocational training, which is and for people, women and youth based in rural India. So and as I said, when it all emerged from the fact that the migrant workers were going home, and we wanted to skill them in such a manner that they didn't have to go back to the city, and they were self-sufficient, and they were able to lead a life within their community in their respective place of where they live. So that being the idea. So what we do in particular is we impart skills on two fronts. One skill is skills for entrepreneurship and skills for employability. So that there are two different aspects. So one helps you. We try and prepare the students to start a small enterprise or a business venture of their own. And the second one is to help them find their feet in a corporate or in a company in terms of basis their competency. And so that's in terms of when we talk about entrepreneurship. So we focus on 2-3 areas again. One is primarily the rural vocations, which is agriculture and allied enterprises like poultry, beekeeping, honey cultivation, mushroom cultivation, goat rearing, and things like that. And the other side of the story is slightly urban vocations, which is tailoring, mobile repairing, motor mechanic, beautician, and skincare. So these are the things that we try and focus on. And in the process, what we have done is, honestly, I as a person don't have the competency to teach so many things. So there has been tie-ups with certain knowledge partners. Like, for example, for the agriculture and allied enterprises, we work with Krishi Vigyan Kendra. So who help us impart the technical aspects of agriculture and poultry and beekeeping and all that. And on the other side, for the urban vocations, there is an NSDC affiliated partner called Yuva Parivartan, who assists in technical aspects. So what I do is then everything, keeping the technical aspects common, we skills on the entrepreneurship. So the basics of what is, who is your customer, what does the customer want, demand, supply, pricing, how to maintain books of accounts, and things like that. So that at the end of the period, the person is competent both technically on the respective chosen area of vocation, and at the same time, he or she is ready to start a small scale enterprise of their own. In the process, we also try and connect them to, finance, the Mudra loans, or the government programs. There are quite a few government programs and schemes which, and you'll be surprised to know that they're quite effective and very relevant for the people. So we try and connect them so that they can start this venture on their own.
Yeah. Thanks, Proteek, for sharing. I'm actually going to stay with you, and even before we understand a little more about NeevJivan, how did you choose to be an entrepreneur? Was that like the need came about and so you jumped in, or were you always certain that you were probably going to start something on your own and not be employed in another organization? How did that happen?
For me, you mean the transition? I'd already explained, right?
Yeah, but I'm just curious on what was there something specific about you starting up an organization versus, let's say, working in another organization? Because a lot of our people who apply ask us that, right? Like, what if how do I make the choice of whether I want to be part of another organization? I want to start something on my own. So just curious on that.
So the experience, my past experience has been in operations. So I've been heading the operations in Gujarat circle for the Vodafone Business Services. So I've been complete operations and execution experience at least for the last 10 years. So I thought, why not use this competency and use this experience of mine in terms of execution and start something on my own rather than be part. I mean, that was definitely another option available to me too in terms of joining another organization. But I thought I would be more effective in using my skills by starting this organization.
Thanks, Proteek, for sharing that. I'm quite sure you'll have at least half a dozen people reaching out to you, because increasingly, one of the questions that I get asked during the interview is, if I want to start something on my own, who are the alumni who've done that and how did they go about it? And so
I'll be happy to engage with them.
Yeah. And we tell them, right, I think ultimately change happens in so many different ways. And so you need to pick what works for you, right? There's no one thing better than the other. Ultimately, it's about what you see yourself as making the maximum impact. Thanks so much for sharing that. Proteek, I also know that your first batch of students have graduated in agriculture and allied enterprises. So tell us what that felt like, if there is maybe some story that you can recall. Just curious on what happened, because the first batch is always special, right? And so curious on what happened there, and also what are some lessons that you're taking away from the first batch as you do the subsequent batches?
Right. Yes, the first batch has graduated, but it is the job is not over for us, because while certification with respect to certain vocation is definitely part of the curriculum, but at the same time, helping them find a job or start an enterprise is an equally important aspect of the curriculum. And unfortunately, because of the second wave, we got derailed a little. Once the first batch finished, the second wave came in and we had to suspend everything for the time being. But now, good news is we have started, it's been picking up now. And we have almost completed, at least one batch of the entire batch of 14, 15 students have got engaged with one program of the government, which is a plantation cum livelihood scheme, which is under the Mahatma Gandhi Gramin Rozgar Yojana. So as part of that, we have connected all these 15 student farmers of ours. And in the process, what they do is they get to plant trees or saplings of fruit-bearing trees, and the government compensates them to take care of these plants for about 3 to 4 years, and they earn about 1 to 1.5 lakhs during this period. And at the same time, after the 3-year period, the fruits and everything else is theirs. So in the process, what happens is there's one steady stream of livelihood which has now started for this group of people. And we are also looking to add one more layer, which is that of the poultry. So that is on the card. So we have been trying to, we have applied for multiple, the Kisan credit cards and Mudra loans at different banks and finance organizations. Hopefully that should come through, and then the job is done.
Yeah. Very exciting. All the very best. I also think, you illustrating the organization's work just clearly talks about how we can augment the government capacity to do change.
Absolutely.
So I think that's also something that's coming out very clearly.
Even I was surprised, the kind of learning you would say that, there are so many schemes and programs for the government, both central government and the state government, which is available to the people in the villages, and very effective, very good schemes, but unfortunately doesn't reach them. So that's the challenge. So the connecting them and facilitating this, the connect is also a very important aspect.
Yeah, that's true. Thanks, Proteek. And that's perhaps a really natural segue to go to Romonika to ask you about, firstly, tell us how did CSF and this role happen? And you need strategic partnerships. You worked with the government before. And so what is that? What is similar? What is different? Tell us more about that.
Yeah, right. And I'll also quickly go back to the earlier questions you said a lot of participants ask is to which is the right choice that I should make. Speaking from that, I'll come to, starting with that, I'll come to CSF. So it's probably a relook at your own skills, your own competencies, and what makes you to, in that space to feel good. Because we're all transitioning from one settled way of life into an unsettled way of life. And kudos to Proteek for being a pioneering spirit in this, completely way out of his previous comfort zone. That is sort of what led me to hark back to my own little bit of an education exposure, although that was at the university level. Also, I come from a family of teachers. Even my grandmother and sisters are all teachers. And when I finished college, I was under a lot of pressure to do a B.Ed. That, let's do the B.Ed and then we'll see what else. So, of course, I didn't travel that path, but education, is part of something that we're all exposed to. And so I leaned on that familiarity. The second thing I leaned on when we were exposed to multiple organizations through ILSS and otherwise, is my competency in sort of calibrating at different frequencies, being able to think on my feet, because I know I mean, bureaucrats tend to be labeled with one large white, black and white label, but there are a lot of grays in between, right? And being a bureaucrat in the telecom sector, as our Vodafone friend will know, has been a constantly changing journey. So actually, when I joined service, soon after, the new telecom policy came out. And I sort of seen the telecom wave from the crossbar literally to the cloud now, that has become a reality for us. So we've had to adapt with technology almost every year or 2 years. So not set in stone as the perception of bureaucrats is that. And I like people, so I like connecting with people. So when this coupled with the fact that CSF deals a lot with the policy level, looks at systemic change, I thought that would be a good, sort of leveraging my skills and a good sort of opportunity to sort of be able to make a meaningful change. How did I hear of CSF? I actually heard of CSF when a friend of mine, her daughter was an intern many, many years ago at CSF. And that's when I first heard of CSF. And so that came back full circle.
Sure. Thanks so much. I'm going to stay with you and ask you to share a little more about your role on strategic partnerships. So what is an approach that you take to partnerships, and are there different types of partnerships? What are some lessons that you've had on partnerships? Because partnerships is a role that we increasingly see a lot of organizations open up, right? And it's also a role where in a lot of organizations, they're specifically looking for people who've been in the corporate sector and other sectors to come on and support the organization. So just give us a little bit preview into what is the approach to partnerships, what are some of the types of big partnerships, and what are some lessons that you've had in this work on partnerships?
Well, to start with, when I joined during the pandemic. So my onboarding was virtual last year, exactly almost a year ago. So partnering on the virtual plane is a whole different experience, right? So whether it's internal stakeholders or external stakeholders, it's a whole different experience. But which is challenging, but at the same time, very interesting. When I joined, the new education policy just came out last year in July. And that was sort of what CSF had been working on, evidence and research and policy suggestions to some state governments and with the central government before the NEP came out. That sort of was a natural segue into my role, because we were then actively looking to support primarily state governments and central governments, along with some other partners in the ecosystem, with sort of decoding the national education policy, specifically around a key lever that we at CSF feel very important, is the idea of FLN, foundational literacy and numeracy, which we feel is literally the key, the key lever to make our children, self-sustaining and equipped, and then, it sort of gradually leads them to not necessarily a university degree. It could be just learning a skill and, making themselves self-sufficient. So we feel that there's this inflection point by grade 3, where if a child has learned to read, only then a child will be able to read to learn. And that sort of just carrying that message across various levels of the education and non-education ecosystem form the crux of my work. And a couple of significant partnerships that I sort of managed to cement was an understanding about a sort of relationship between CSF and the government of Bihar, with the government of Punjab, the government of Assam, and most recently in the last month, the government of Orissa. So much of this was virtual, though I did get to travel a little bit. But so that was. So
tell us a little more about that. How is it to, in my previous avatar, I used to look at a lot of government partnerships, but this was pre-COVID times, right? And so everything was literally like sitting outside the government office and waiting for that person to see us. So I'm just trying to wrap my mind around what do virtual government partnerships look like? What is it? What does it look like, Romonika? And what are some strategies that are working there?
So we actually, like everyone else in COVID times, in all spheres of life, we built our strategy as we went along, right? Because like you said, much of this, earlier sort of thinking around policy and advocacy has undergone a sea change on both sides of the table. So the government also has become much more approachable and accessible on a virtual meeting than possibly, like you said, otherwise we would be waiting somewhere. So I'll share very quickly an interesting story how we managed with the government of Punjab. Of course, everyone is very busy in office, especially in pandemic times. There's a huge responsibility with government. So we had fixed this particular time with the person that we were to speak with. And I was pretty new in CSF, I think 4 or 5 months old at CSF. And I had a bunch of CSF folks on the call as well. And I had sort of fixed the time. It was about 2:00. And of course, the person that we were to talk to was not free at that time. So I was on the line with the PA and, is he free, not free and all that. And then we sort of, by 3:30 or so, we were all on mute and we were all doing our own work. 3:30 or so, she said, look, I think the PA called me and she said, madam, I don't think it's going to happen today. Then fix kar lete hain. So I said, haan, theek hai, and all that. Immediately, of course, CSF being very supportive, one of my colleagues came across and said exactly this, what you're saying, Archana, that look, it's much better than having gone to Chandigarh and spent 2 days there. So don't worry, it's fine. And, so we all dispersed. And within 5 minutes, the lady called up and said, Saab is free. Can you all come back on the call? In the meantime, someone had gone for a bio break, water, this, that, and, it was interesting. It was a nerve-wracking experience to get everyone back on the call, but then it went very smoothly after that. So we are all learning as we go along. And I think it's the pandemic, tragically sometimes, but also socially and professionally has been the great equalizer, right?
That's so true. Thanks so much for sharing that. I do think in whatever we can call a post-COVID or the new normal of the embracing COVID world, technology will continue to transform things. Like literally, it's in our homes and in the offices, and I do think that's not going to go away anywhere. We also have Anu joining us. You might have seen us, and so Anu, feel free to come in as well. I do think alumni panels always are very special for us. So yes, that's Anu there waving as well to all of us. Thanks, Anu. Katie, I'm going to come to you now and ask you to start by sharing the same thing, which is among the different opportunities that are there in the sector, how did this particular organization and this particular role, how did you pick it, or how did that pick you? And then tell us a little more about what you do in your role.
Sure. I was looking for a role in the social sector, right, in which I could probably use a lot of my previous experience in product development, medical devices, sales and marketing, and consulting, right? I wasn't sure whether I would find a role like that, right? And it so happened that Equalize Health was also looking for a person who had a medical device background, sales and marketing, and consulting. So they were also not sure whether they would find a suitable candidate, right? So in a way, we kind of found each other through a headhunter. Hats off to headhunters; they actually make it happen. Some of these very, very strange and difficult partnerships happened. So that's how I kind of found an opportunity, because while I was sure that I would be working in the healthcare space, and of course I had also made a decision that I would work on the operations side of healthcare and not on the funding side of healthcare. Right? I mean, healthcare, you get social sector roles have people who fund other projects as well. So that's how I kind of, found Equalize Health. And so what we do essentially is we are a nonprofit who design medical devices. And as the name indicates, Equalize Health actually looks to equalize health outcomes across the world, right? Which is to say that there's a lot of inequity between the health outcomes in the developed world and the developing world. And we try and ensure that the outcomes are equalized through appropriate medical devices. So ours is a little bit of a unique model. So we are a non-profit who thinks like a for-profit. Right? So which is to say that, we are a non-profit in the sense that we look at all the activities, which is, understanding the user needs, doing the design, prototyping of the devices, conducting, user studies with the designed devices, and of course, certain clinical validation of the products wherever it's required. But we also think like a for-profit in the sense that we don't choose products which don't have a demand. Right? So we are pretty much market focused when it comes to scaling up, because otherwise we find that a lot of products get developed without sufficient research into the demand, and then they just are interesting projects. They don't make it to the commercialization stage. So once the product and its viability have been and feasibility have been established, but then we engage with commercial partners. And part of my role, like Romonika, is with partnerships, where we engage with commercial organizations, medtech, medical devices companies, for scale up, which is everything from manufacturing, sales and marketing, distribution, installation, training, commissioning, the whole works, and all the downstream activities. The other thing that we do is to also measure the impact of our, and we don't measure the impact through commercial terms like number of machines sold or market share or revenues, etc. But we look at it in terms of health outcomes, right? Like lives saved, of patients treated, lives saved, and then of course some very quirky health, metrics which make sense only to health, global health folks, like this disability adjusted life years and so on and so forth. So that's how we work, and we have a young and very passionate team in India, and I lead the team here, and it's been exciting 6 months for me.
That's great to hear, KK. Yes, I think an impact definition is such a key thing, right? Is you can, and like they say, what you measure gets done. And so how do you choose something that's eventually meaningful, not just from an organization perspective, but also from the ultimate stakeholder, the ultimate beneficiary, such a powerful lens. I'm curious, I read that your organization had done a variety of things, right from developing solutions for economic empowerment, agriculture, and education before narrowing down to health. Now, this is something we see quite often in the social sector, right? That go broad, explore multiple things, and then sometimes come back to, okay, maybe this is our core. And so what were some factors that led to that health focus? And would you say that there have been any other pivots in the journey like that based on what you learned from the work?
Yeah, so going back to the founders of it used to be called DREV, and DREV used to stand for Design Revolution, and our original name was DREV, designed for the other 1 million. Right? So the idea was that the question was, can we design solutions which impact the lives of people in developing countries, right? And our two co-founders, one is a medical doctor, the other is a technologist, right? And both of them, the medical doctor, Paul Pollack, also had a background in international development. Right? So that's how, and of course, the other co-founder, Kurt Kuhlman, is a technology expert in Stanford. And, we kind of then started casting the net wide, looking at technology for a variety of problems like education, livelihoods, and so on. But as we look to scale, right, we realized that we were largely like like a typical Silicon Valley garage. A lot of interesting, cool stuff, which is there. But when it came to scale up, we had to focus, right? And also because then and now we are a small organization, and therefore for us we needed to focus on a couple of themes, and we kind of chose healthcare, given the fact that the disparity between the developing and developed countries in terms of outcomes was perhaps the most stark. Right? And right to life is perhaps just the most basic of human rights. Right? And therefore, if a life is saved, that's perhaps then it offers the potential for education and livelihood and whatever else. Right? The person needs to live to be able to. So that's how we kind of decided to focus on healthcare. And in the last few years, I think there's been further narrowing of this, I would say. We started with healthcare as a broad area, and in the last few years, we've been focusing on maternal and newborn care. That is healthcare related to pregnant women and newborn children. And that's been pretty much the focus of our work the last few years. So I think starting with a broad set of areas to focusing to healthcare, to focusing to maternal care, it's been, more and more narrow focus. But I think that's been helpful for us to, address those concerns and problems which we believe we are best equipped to address.
That's incredibly helpful to hear. I know that the other lens that your organization looks at is the geographies, right? So I understand that your work in USA, in Kenya, and in India. So for example, in your role, what is the global focus contextualized to India, and what is India specific? How do you, what are those two perspectives like?
So I think when, TREV started looking at India, right, or I say TREV because that it precedes the time we're calling ourselves Equalize Health. I think it was, largely considered as a market for impact, right, where, the maternal mortality rate and health indicators like the newborn mortality rate is very high, amongst the highest in the world. So there's an opportunity to create an impact if we focused on India. But I think over time, the focus has also changed into India as a market for talent of different kinds, and also of late as a market for ideas, right? Ideas for healthcare innovation. And I think that transition has also come along with a general feeling within the global health community that we need to have more people in the markets of India. Right? And there is this whole concept of decolonizing aid, right, of which trying to ensure that there is a greater role for in-market teams. Right? So the way we are structured essentially is that all the activities which relate to the activities that we need to do inside India or inside Kenya all happen from here. Right? It could be, like I said, understanding the user needs, doing, the competitive landscape mapping, which varies from country to country, taking the feedback from the users for the products, doing some of the clinical work. All that happens in India. India is also a big manufacturing base for us. Our current product portfolio is manufactured out of India for the global through our manufacturing partners. And similar thing in Kenya, which is it's slightly newer geography for us, but pretty much the concept is that we will do a similar set of activities in Kenya over a period of time. So the US office essentially has what a global leadership team is, and also in all the corporate functions. A lot of the actual prototyping and product development happens in the US. Right? And then, of course, aspects like global communications and fundraising. That also happens in the US because it's a very developed market for fundraising. So that's some of the ways that the global activities and those of in-market affiliates kind of line up. And we're looking to replicate this model in other geographies.
Nice. Okay. Yeah, that's really, really encouraging to hear. Thanks, KK, because it's always interesting when you're part of a global organization and how do you think through what stays global, what stays local, how do you leverage the local strengths of each country to be able to do things at a global level. So these perspectives were really helpful. Actually, across all the three panelists, thank you so much for giving us a little bit more preview into your work, because you've taken out such precious time to be here, and so we wanted to give our attendees an opportunity to learn a little more about your organizations, and through that lens, the diverse sectors that you all represent as well. So it was sort of like, health 101, education 101, and skilling 101 from your perspectives as well. Really, really appreciate that. I'm going to actually bring us back to our transition journey and our individual journeys to see what are some other reflections that we have. We've been, we used to say there's a lot of unlearning that we have to do when we move to the social sector. And increasingly, we are finding that it's actually not unlearning, it's maybe relearning or contextualized learning. Like whatever we learn or whatever we've learned so far in the corporate and other sectors just need to be remodeled and reapplied in the social sector. So whatever we decide to call it, that's for another time. But what has been the process of learning for you as you made the transition? What was easy and what was perhaps difficult? We can start with anyone.
Yeah, I can go first. I think for me, the process of learning, started with even during my first interview with Anu, before I joined the program. It was part of the selection process, like Romonika mentioned, right? The first thing she said is, don't think that social sector is like a light job, pre-retirement kind of job. So be very clear, this is probably going to be as, or perhaps even more, hard work than what we've done in a corporate. That's one. Second is, don't think that you're a messiah, right? This is something that I keep telling everybody. We are not a messiah. I think we need to have a lot of humility, right? I think to approach this sector as a student rather than as an expert, I think will help us be more grounded and set ourselves up for success. Even if we know the sector well, like I have, and like Romonika and Proteek have. But I think it's also important to have that humility to approach it from a different lens. I think that was perhaps the biggest, learning for me. And also, in the corporate sector, right, we are asked to look at timelines for impact in terms of whatever days, weeks, months, at best a quarter, right? Now, the timeline for impact in social sector is going to be phenomenal. It's not going much, much longer, probably even longer than our lifetimes, right? But the fact is that we need to persevere and we need to, be at it, so to say. And then finally, I think the thing is how to be optimistic, right? Because this challenge, the sector and its challenges can be overwhelming, but we need to be optimistic, celebrate success that has been brought about, and of course, kind of remain committed to ensuring that those small, it's like you chip away at the difficulties that are there, and likely to be a big bang transition. it's probably going to be several small steps that we need to take along the way. I think these were some of the lessons, and no, nothing was easy. Yeah. I think everything had to be done, as simplistic as it might sound, but I think when you actually implement it, there's a lot of mental blocks which need to be overcome. But I think those takeaways will probably stay with me forever.
That's brilliant. Thank you so much, KK. That sums up pretty much like what we say across all of our things around, like join the sector if you want to be, not if you want to be savior, not if you want to take it chill after years of service. This is not the place for you. Thank you. You put it really, really well. Thank you. Proteek or Romonika?
Yeah. So there are lots of, when we were in the crossroads, and there were lots of saying, that certain things work in the corporate world and those things may not work in the social sector. And we have been told, we need to, start mentally preparing for the way the social sector works. But basis my experience, I will tell you one thing which is common between the two. Between the corporate world as well as the social sector. And that is one word, empathy. So we need to, as long as we are empathizing with the people that we work with, we understand their needs and we are able to cater to them, your home. So that is according to, and the same thing works in corporate world as well. So when you're working with a team, you're working with people and, expect certain things to be done. Again, empathy plays a very important role, So one thing that is common across both, and I'm sure all of us have this within us. And if you play if you are, strong enough on this front, according to me, anyone would be successful in the social sector.
Thanks so much, Proteek. Yes, in fact, for all the different worlds that they seem like, there are things in common, and how do we operate with empathy across what we do, irrespective of the sector? Just something so powerful. Thank you so much for sharing that. And Romonika, to you.
Yeah, so I'll probably split it up into two levels: the personal and the professional levels. Of course, professionally, I completely agree with what KK and Proteek had said. It's a long journey for all of us, and we are there only for part of it. When we want to be the change, but we may not see the change at some point of time. But yeah, and empathy leads me to the other learning that I've worked in different milieux, different countries, government, sat across the table with STDPC operators at one time, and a lot of heat in the room and all that. And now an organization that works tries to make a systematic approach to social change, but also a lot of Excel sheets going on there. But really, people are people. Similar to what you said about empathy, and that works, from the negative to the positive end of the spectrum. There have been roadblocks here as well. So, for instance, just to make it a little personal, the challenge that we always think that, okay, gender will be a challenge wherever you go for a workplace. But for me, gender was the least of the challenges, really, as it has been in the government. The government is completely gender neutral, and I really appreciate that about all the colleagues I've worked with in the last 30 years. So gender was the least of the challenge. Age was a little bit of a challenge, because once we were prepping for a meeting with government, and so you're like, okay, who's going to do what and whatever, and that sort of a thing. And of course, it was all virtual like this. So somebody said, yeah, and Romonika, gray hair at the table. And I was like, hello, what? So I was like, okay. But then, of course, another colleague who's an ILSS alumni decided to call us the gray eminence at the table. So yes, so the gray eminence sounds better because it refers to gray matter inside as well as the gray outside. So yes, that was a bit of a learning, the way people look at you. And while office was open, I did also have a couple of younger people just come up and talk to me, just to see how it is like, I think, to talk to a bureaucrat. So, I mean, like, hi, can I have a walk with you, or shall we have a coffee? And, so like, yeah, sure. And I mean, although our work did not intersect, but it was just, let's have a coffee together kind of a thing. And it was interesting for both sides of the thing. So there was a lot of learning and unlearning going on, all across. The third challenge, which is a professional challenge as well as a personal one, is that of location, because we have all been largely virtual. But also physical location. I've never worked in an open plan office before. I always had a place of my own with plants and that sort of a thing and all that. So open plan was a bit of a something to think about. But also location, because on the personal level, my husband, my children, and I are all under 4 different roofs, and very often living in 4 different time zones. And they have been very, very supportive and very, very encouraging. So that's got us all to learn how to deal with something and unlearn the traditional paradigms of how can this happen? Why is she not there with them? And, that all that sort of, shifting paradigms for everyone across the thing. And the other thing, of course, which again is common to organizations which work for systemic change, obviously, but there's always the unpredictable, and we have to be prepared for that. So like I tell my daughter and my son, life is what happens around the edges of the Excel sheet. It's however much we may focus on the Excel sheet, but life is usually, or life or the meeting or the opportunity or the sudden shift of the goalpost at work, it's what happens around the edges of the Excel sheet, really. So those are like some of the things that I've learned and unlearned. And of course, relearned that, yeah, I can pull it off, which is something I wasn't sure of earlier. But yeah, that's the biggest learning.
Definitely. So inspiring to hear all of this. I'm going to actually pause and see what are some questions that we have. Folks who are attending today, please go to the Q&A window, and so that we'll take questions through the Q&A window. I'm going to start with, actually, there was one question on the chat window, KK, that was on health. So we'll perhaps start with that and then hop over to the Q&A window. So this question is from Pankaj, who asks, how does your organization work in rural India, given the low penetration of health workers and professionals, is what he's saying. What's been your experience with that?
I think it's definitely true. I think the fact is that, there is 2 levels of problems. One is the sheer inadequacy of health workers just in terms of numbers, but also in terms of access to learning. Right? So one of the things that we do at Equalize Health, which is apart from our product development, is a program called ECHO, which is a telementoring program. And what we do is we run programs for different kinds of healthcare professionals. We run it, in fact, as we speak, there's a program that we run in the state of Chhattisgarh. And this is for the nurses in the public health system of Chhattisgarh. And we train them on different aspects of patient management. Right? So it's largely around clinical skills, but also trying to help them with things like creating a quality management system for the hospital, disposing medical waste. Another, I would say, life skills, like how do we convey, unhappy outcomes with empathy to the families, right? And so on and so forth. So that's one. And then we run a similar program for doctors in the state of Uttarakhand as well, especially for doctors who are in Uttarakhand but not in Dehradun, right? Because Dehradun's obviously got much better healthcare facilities as compared to the rest of the state. So how do we kind of ensure that the rest of the state also has similar supplementary program? And similarly in Kenya, we also run a program for hospital biomedical engineers, people who maintain the equipment in the hospitals, as to how to repair and maintain the equipment so that it's up and running whenever it's required. So I think this tele-mentoring that we do is complementary to and a very, I would say, a critical component of our pathways to it.
Thanks, KK. I'm going to read out Sandeep's question and would actually love to hear all three of our panelists' perspectives. Sandeep Sehgal asks us, my limited exposure evaluating the crossover presents a bottleneck that I find social sector towing the line of corporate sector in being as competitive and trying to score brownie points or one-upmanship, which I feel like I've already had enough of, and I'm looking to get away from that. I'm looking for something which is more of an accommodative and an approach that's filled with camaraderie across organizations, professionals. What's been your experience? And Sandeep is curious on, is there some truth to his observation, or is that a limited perception of his? Would be curious on what has been your experience and what are your perspectives on this for all our panelists.
Sandeep, I have a very a kind of a little radical answer to this question, right? Where the people are involved, there is going to be one-upmanship, competition, be it social sector, be it corporate world. Wherever you go, wherever there are people involved, there is going to be something like that. So I don't think you will be able to avoid, that thing. But yes, if you are, even I almost had a similar thing, and that was one of the reasons that played in my mind to start something on my own. Then you live your own terms. You work at your own pace. You work, you call the shots, and that's when you define your organization culture. You want it to be competitive, or you want it to be more camaraderie, driven by camaraderie, or the way you want it. So I mean, that's the way I look at it.
Thanks, Proteek. Anything the others would like to add?
I tend to agree with you that certain amount of cross-learning happens only when there's sort of interaction with someone who's possibly better, or if not as good at you at their work. So that sort of making sure that everyone is giving the best in their work stream without letting it degenerate into a turf war is something that it depends on you really how you want to take it. I mean, the government, for instance, encourages everyone to be their best, but is very supportive, but there's never any trying to be one very close to the boss kind of a thing, as perhaps maybe more evident in a corporate setup. But in the social sector, really, it's challenging to work with people. Like, for example, at CSF, the people heading the other teams are super, super talented with varying backgrounds and varying experiences. So it is definitely challenging, not coming from such a diverse background. But then it's up to the person themselves not to let it degenerate into a turf war, but to support each other and learn from that, really. So I think it's up to you what you want to make out of it.
Thanks, Romonika. And KK, any perspective?
I think I'd agree that the social sector being so interdependent, I think it's inevitable that we will have challenges not just from within the organization, but also the extended community that we work with, right, to address social challenges. And I think, I agree with Romonika that sometimes, having a low EQ might, or a high EQ and low, sense of competition sometimes, probably is helpful. I think that is my way of addressing some of these challenges which are inevitable.
Yeah, and I think, sorry, I'm adding to that, to what KK has said. First thing we could do when we step into the social sector or any other public space really is to leave the ego at home. And once we do that, it's fine. It's, you just leave it at home in the cupboard and then get on with life and do what you want to do. If you want to do it, then it's fine.
Yeah, thanks, Romonika. I'm going to pick up Rakesh's question next, which is, what is the biggest challenge a newcomer in the social sector should be ready for? And we could hear from maybe one or more of you.
Could you repeat the question?
Sure. His question is, one moment. I just skipped what is the biggest challenge a newcomer in the social sector should be ready for?
I think the ego at home. Sorry, I interrupted you.
Please go ahead.
No, I just simply repeated it. I think leaving your ego, your sense of whatever defined you previously, just leave it at home.
Yeah, and at the cost of repetition, I would say that empathy is the thing that you need to be really be equipped with when you are reaching out to the people that irrespective of what field you choose in the social sector, but the people that you are working with and or working for, you need to understand their needs and to some extent to even stay with them and understand what their requirements are and live with them and then find your way through your solutions and the work that you're doing.
I think what I'd like to add is we need a lot of patience, lots and lots of patience, because this is a really slow, it takes time, real time. Building consensus, within organizations, and in some cases, right, some aspects of social sector work, right, have been institutionalized over thousands of years, right, and therefore, to effect change in some of these is going to be a very, very slow process. So I think patience, because I think in a conventional commercial organization, right, because the timelines to impact are short, right, you can pull rank, right? You can say that I am the whatever head of the practice, do as I say, right? In social sector, you can say that, but probably just once, and after that, that will be the first and last time you say that, and you're successful. So I think that's perhaps the biggest adjustment, that it takes time, and one needs to give ourselves enough time to be patient and to make change happen.
Thank you for sharing that. Keep your ego at home. Have the empathy, because ultimately that's going to keep you going, and be patient because this is long-term work. Romonika, I remember, what you shared about, be the change, but most likely we're not going to be here to see the change. I think it's just a testimony to all the things that you all have shared. I'm going to pick up Asim's question next. Asim says, thank you for sharing insights into your transition from the corporate to the social sector. Very informative. Did you feel that there were gaps between what you'd expected the social journey to be and what it actually turned out to be? And if yes, how did you deal with those gaps?
Yeah, I think I'm still in the honeymoon period for my organization and transition. So I haven't, had disappointments. Obviously, there have been challenges because of COVID. The fact that I have never met my team. The team has not met each other, and it's all like Romonika mentioned. Having everything being done electronically, virtually across geographies. That's quite a challenge. So I think that's been, I would call it as a cause for concern, but it's just not the way it would have happened ideally.
That's so true, KK. We often talk about an ILSS because it's almost been a year since I started, but we've not met as well. And it's just so bizarre, right? Because otherwise, typically, especially if you're in the same country, like we would have definitely met the first month or this. And it's also prompted us to really rethink partnerships, what is trust building, everything in a remote environment. So yeah, it's been a very, very different journey. Proteek and Romonika?
Yeah, regarding Asim's question regarding what did you expect when you started off, and what did you how did it turn out? So one of the biggest challenges that we faced, or rather we are even facing now, is mobilization. So mobilization of students to come and learn. So when we started off, we said, okay, now I'm setting this up. That's a need of the people, and so people would come. No, it's not like that. It's very difficult to convince, but the thing is, it takes time. But once they are with you, once they gain the trust, they are with you for a lifetime. So as KK mentioned, it's a honeymoon period for us, but it's a slow and steady journey. So as we are learning, we finished one batch. The second batch is just getting onboarded. And as we are showing results for the first batch, then it's going to the next round of mobilization is going to be easier, because people are seeing results and now they would like to get associated with you. So and as we progress, maybe maybe same time next year, life would be much smoother for us. Yes, so that's one of the challenges. What we thought would be easy, but it turned out, it is turning out to be difficult, but I'm sure we'll get over it.
Proteek, also to share, Asim is just about to start his transition journey. So I think he's listening very carefully to your answers.
Okay.
So then I'll try to be as precise as possible for Asim. So of course, one thing, it was way more intense than I anticipated it to be. And of course, the intensity of the workday also got aggravated by the fact that we are all working virtually. So in fact, after the first 3-4 weeks, if there were gaps in my calendar, I felt like, oh my God, what am I doing? How do I know and how do I show that I'm working, right? Because this is virtual now. So that was one, and of course it is intense because it's a way of working which is different from probably the traditional social sector approach. May have been more hands-on, equally intense, but more hands-on. Whereas right now, a lot of organizations have more almost semi-corporate approach to bringing change about. So that was a bit of a challenge and a change for me. The second, of course, the whole virtual situation. So one had to, which one always does when you join a new profile, you assume a certain comfort level even when you don't have one. But in this case, there was more of that, because if I had to lean on a colleague to approach an external stakeholder, I had to sort of just lean on the colleague and hope that the whole thing falls in place. So there is that. And I think the third part would be, for me personally, the whole the whole idea that I'm not working for a big entity, but working for a person's vision and sort of answerable for someone else's hard-earned money. So coming from the government, this sort of personal, I've always had that value for money concept in my previous life as a finance person, but to be answerable to a person-oriented organization was a bit of a change that I had not actually anticipated that would make a change in my mindset, because my salary came from the Consolidated Fund of India, and government was very supported, and that's nameless, right? So sort of it was a difficult, conscious, it was a weight on my conscience really to be answerable to this and to make sure that I'm delivering value for money there. So I think that just about covers the challenges.
Yeah. Thanks so much. I do think, Asim, all the very best as you start your new role. And I'm sure that these insights are going to be things that you keep at the back of your mind. And of course, you can feel free to reach out and have offline conversations as well. I'm going to pick up Giri's question, which is another question that quite a few people engage with, which is within the social sector, there is not-for-profit, and there's also for-profit social enterprises where the profits are plowed back into the work. And so is one better than the other? Any views on that? Or or are these different models? How do you see both of these different ways of operating within the social sector? Anyone who has a perspective can share.
I can take that. We are in a way like a social enterprise, though our component of earned revenues is very small. And no, but I think it's an important concept, especially the fact that more and more donors, right, are expecting that organizations will have some revenue stream to complement the philanthropic money that's coming in. I think that is one. Secondly, I think having a social enterprise kind of outlook also helps you to invest in talent, right? Because obviously, some initiatives, philanthropic money, many occasions just goes towards programs, right? And therefore, some of the capacity development, skill building within the organization to be able to, address the needs of the internal stakeholder, the employees, and so on. I think that makes it easier. That's facilitated if we have a second revenue stream. And I think it's also, given the uncertainties with donor money, right? Variety of reasons, not, related to COVID, but, perspectives change and so on and so forth. So I think it's always a good idea to have that. I think it makes the organization definitely sustainable.
So I can share a perspective from the outside the sector. So our consultant is always non-financial, and when we were talking to a particular stakeholder, the immediate response was, "Sir, ये तो free में है, ये तो इनको तो ले लेते हैं." So value perceptions are different across different sort of mindsets, really. So I'll just leave it at that.
Thanks, Romonika. Proteek, anything that you want to say?
No, I don't have a major.
Sure. I'm going to take one last question. It's a very interesting question from Ruchira, who asks us, what have you observed in the development for impact social sector, as we call it, that you think the corporate sector should definitely learn from?
I'd like to answer that.
Go ahead, Anu, please go ahead.
No, just kidding. I'd like to hear what you all are saying.
No, please go ahead.
No, I just think the whole leadership by consensus, this whole taking people, because the social sector careers are a more mission. It's a mission. If you're coming to just do a job, maybe this is not the place for you. I don't mean to sound sort of too radical, but I'm just saying there is a higher purpose to what you're doing, because there is no bonus or there's no big payoff at the end of the year. So I do think this whole leadership by consensus, taking people along, I think that's, because everyone's there for that common vision. I think there's no hierarchy. Like Keke touched upon it, when he was speaking about it, that yes, of course, there is a hierarchy, but really it's a very different approach. And so hats off to those leaders in the social sector that they drive their teams to achieve, because it's a different incentive. So that's my
thanks, Anu, for coming in with that. Yes. Anyone, KK, would you like to start?
I think certainly the other piece is how to engage with multiple stakeholders. Right? I think that's pretty important, because many times in commercial organizations we find that there are power centers, right? And many times work doesn't get done because people don't see eye to eye. But here in the social sector, we are trying to effect change by bringing in so many stakeholders who probably have very different perspectives and so on and so forth. So I think to be able to replicate that method of engagement, right? And I think that's something which certainly is something which the for-profit sector can probably learn. I think I would not learn, but I think do better and do more.
Thank you. Proteek, Romonika, anything quickly?
No, I guess Anu and KK has mentioned, covered it.
So. Yeah, I think so. Yes.
That's great. Well, folks, thank you so much for joining us. We have deliberately prioritized the questions around transitions, hoping that if you have questions specific to organizations, I think they were specific to the roles, that we can also reach out to our speakers offline. And so thank you for being patient as we prioritize the questions around the transition journey, because that's ultimately the core purpose for bringing 3 of our alumni from the flagship leadership program to this alumni panel. Thank you so much, Proteek, Romonika, and KK. Thank you so much for joining us today. As I always say, nothing like hearing it from alumni who've gone through the journey, who literally, done this, been on this journey, and to hear from y'all on what's been your experiences, what were challenges, what were learnings. And so it's super, super valuable to have heard from you all in this journey. Thank you so much for taking the time and sharing about your transition journey, your organization's work, as well as just a little more about yourselves as well that we've learned in this conversation. I really, really appreciate it.
Thank you very much.
And thank you, ILSS, for all that you've done, and wish everyone on the chat and on the webinar all the very best. And thank you, ILSS. I still have your notebook. Okay.
That's great. That's great. In fact, as we hear from Proteek and KK as well, you'll see the message there. We do have an online webinar tomorrow with Rahul Bose, who's talking about the act of giving and understanding and being a part of equitable development. And so for those of us who are keen and able to, please do sign up and join us for that as well. I did want to put that in, Isha, before I forget. Of course, Proteek and KK, any closing comments from you both?
All right, thank you very much. And the entire ILSS team. Actually, you guys helped me take that final call on moving to this sector. I'm happy to be, being part of this forum and to share my experience. And I hope I'll be able to help anybody else who is wanting to, to cross over to the social sector. I'm available, either on mobile, on phone, or any other media. You can write to me for any queries that you may have. I'll be happy to talk to you.
So thanks, ILSS team. I think it's been wonderful engaging with all of you, of course, again, but also with the larger cohort of participants. Wishing you all a very successful transitions when they, how they occur. And like with Romonika and Proteek, if I can be of any help, I'll be happy to assist. Good luck with your respective transitions and careers.
Thank you so much to the 3 of you for working with us behind the scenes, joining us today and sharing the experiences. Very, very grateful. And to everyone who joined us today, I hope you got perspectives from people who've been on this journey before you. Thank you for joining us, everyone, today. Take care, have a good evening, and stay safe. We'll be in touch soon. Thank you.
Thank you. Bye.
Bye.